Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is brought to you by AACN's Knowledge Assessment Tool, helping educators identify knowledge gaps and educational needs of nurses new to the unit or new to ICU or PCU patient care, with information available at www.aacn.org/assess-new-nurse. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmitt.
Welcome to Voices in Nursing podcast. This is Andrea Schmitt, one of AACN's Clinical Practice Specialists, and I'm joined by my colleague, Dr. Vicki Good, AACN's Chief Clinical Officer.
Thank you, Andrea. I'm excited for today's episode.
Me too. We are really excited to welcome our guest today and expand our discussion on the role of artificial intelligence in healthcare. It feels like AI is everywhere these days. You really can't seem to escape it. But for the most part, AI appears beneficial, but many nurses worry that it may be misused or fear it will replace direct care nurses. And I think that there's still considerable concern about the safety and accuracy of AI tools. So in many cases, AI is being incorporated into hospital workflows with little or no input from nurses, disrupting the workflow. Vicki, have you heard any concerns related to this?
Oh, yeah, definitely. I think many of our community members are concerned about AI. One, is it going to replace them? What is it going to alter in their workflows, and how are they going to work with it? So I'm super excited for our guest today, Dr. Carl Goforth. He has had an amazing career, including service in the U.S. Navy as a flight nurse in Iraq, where he led trauma triage teams and flew critically ill casualties to theater hospitals in support of Operation Iraqi Freedom. So first and foremost, Carl, thank you for your service to our country. Just some amazing work that you've done. As you came back to the United States to start your career, you introduced the role of AI in healthcare as the Chief Nursing Officer of the Naval Hospital in Jacksonville, where many of your young sailors and nursing staff began using AI tools at work. You took their proactive approach and chose to understand AI and then establish standards at your facility. This marked the beginning of your journey to better understand and integrate AI technology in healthcare. So before we go any further, Dr. Goforth, will you tell us a little bit more about your background?
So my background starts a little bit before I arrived at Naval Hospital Jacksonville in Jacksonville, Florida. When I was deployed to Iraq and deployed to other theaters during my Navy career, we spent a lot of time working in environments where it's resource depleted. We're not working in hospitals. We're working more in the field. And what we found was that we needed to bring clinical decision support tools to as many providers as possible. A lot of providers are working in very, very small teams, again, without resources, without the ability to reach back to a hospital, reach back to deep resources. At a hospital, we're so lucky to have all of the subspecialties that you can reach right out to. Sometimes within 5-10 minutes, you can get a mini consult on a client or on a patient. That's going to result in a much better client outcome. And when you're overseas in really, really small teams, you lack that support. So what we were doing, and I was involved for a while in determining what are the best clinical decision support tools that can be used by a nurse or by a medic that's maybe far forward and doesn't have that instant access to the rich resources that we have back in the U.S. So when you think about anyone who gets hurt on the battlefield, and as soon as they're touched by an ER doc or by a trauma team, they're immediately a stabilized post-operative patient. Mm-hmm. And so they immediately, the complexity goes up so rapidly. And then you've got a provider who may not have a lot of experience, or a medic that doesn't really have a lot of experience in the critical care environment. And what we found, we struggled with having only a very few members of the team who had the confidence and had the currency to be able to care for a client like that. And what we wanted to do was we wanted to democratize those tools to as many people as possible. So my interest in AI started well before that. Actually, when I was actively deploying as a young nurse, and as the Department of Defense and the federal government was investing a lot of time and money and resources into clinical decision support tools. In other words, ventilators that had like automatic feedback loops where the provider had instant feedback and was getting instant recommendations on ventilator settings was a big one that we needed. And also EKG rhythms. And so EKG
Mhm.
rhythm interpretation is also something that can be automated. And the tools were not perfect. They were far from perfect. But if you're a novice and you haven't had a lot of experience with EKGs, that was another tool that we started developing that was going to basically provide any provider, even if they were a novice provider, with at least some tools that may help them in their determination of what that rhythm is, whether it's lethal, non-lethal, and also it providing some treatment options. So kind of the
Right.
front runner to like what we're seeing now in this explosion of technology in our hospitals.
Which, you bring up an interesting point that I hadn't really thought about is AI has been around for a while. Because as you were
Mhm.
talking, I thought about the quote unquote old ECG machines, 12 lead machines that would give you a preliminary interpretation. Essentially, that was some sort of artificial intelligence, I would assume, that was doing that.
Right, and so before OpenAI exploded onto the scene, Google had spent many years also exploring this type of technology, and this technology led from what you traditionally would think of data scientists and nurse scientists, and even us as like nurse educators, maybe working with data in our unit and working with like maybe some statistical software like Excel, or maybe something a little bit beyond
Mhm.
that. So we're used to working with hard numbers and then using very concrete rules to make sense of data. And so those initial some of those early 12 lead EKG machines that would give you a preliminary uh, um, basically a prediction of what that rhythm is was using a very specific algorithm with very specific tools. So it was very niche driven, whereas AI
Right.
now has exploded into almost being conversational, and the capabilities have exploded beyond. As you'd mentioned, that's a really good analogy of what we had then just a few short years ago compared to what we have now.
It's amazing to think now, Vicki, that you say that about, the preliminary reads on the EKGs, right? We never thought about that. It also makes me think about, even in radiology where they have, computer aided readings for mammograms. It's like, but we never associated that with AI. And I do believe, Carl, it is like now that it has exploded and it's everywhere. I think the question on the minds of many nurses is now that it's grown so much, can it replace nurses? And I don't necessarily mean in the physical sense, but from the monitoring or surveillance sense.
We already have remote monitoring of patients, whether it's so we've had, how long have we had tele ICU?
Mhm.
And so we've had, for that was that was definitely, the bright and shiny 20, 25 years ago. But now we've developed that. We've had, several decades of tele ICU where you have a small team of nurses that are monitoring a large number of patients. And if you think about it, maybe that was a scary at first. We determined very quickly then that we needed nurses just as badly when we developed and started rolling out telecritical care as we need now. So we've gone through waves of technology being introduced to the critical care environment, and it has never resulted in us losing the human in the loop.
Right. We've all seen different aspects of AI being used, and we've pointed out several of those new ones now, or some of the old ways it was used now. So, where would a nurse most likely encounter AI right now in their practice?
We're going to see a lot more integration at the bedside that's going to be a direct interface with our bedside nurses in the critical care environment, especially when it comes to documentation, which we all know and we've spent a lot of time. I did come from the old paper charting system, along with maybe a few of us on the call, and I would finish up my 12-hour shift, and then 45 minutes after that, I would finally finish up my charting, for the shift. So what we're going to see is we're going to see AI tools that are going to augment and basically physicians have had auto dictation for many years. There's a few companies
Mhm.
like Clinical Works and Practice Fusion that provide them basically electronic dictation and also AI enabled dictation, and nurses are also going to see that coming soon to a bedside near them.
It's so fascinating. And I actually have a question that is related to the editorial in the February 2025 issue of Critical Care Nurse. You and your co-author, Jenny Alderden, advise hospitals to prioritize AI as more of a supportive tool, not a replacement. So I'm sure our listeners are as curious as myself about this. Like, how can you explain what this looks like in action, supportive versus, replacing?
Absolutely. Jenny Alderton and I are very close colleagues, and actually we're both active duty Navy stationed together at one point. So we're both very passionate about this subject and very passionate about the ethical rollout and responsible rollout of AI at the bedside. So what we mean when we said to prioritize AI as only a supportive tool and not a replacement. Well, to extend that sentence would be that again, keeping the human in the loop is really what it boils down to, and ensuring that hospital leadership is not looking to AI to replace hospital staff. In all practical realities, that is going to be basically impossible to do because again, if you think about how AI is trained, and we've seen a lot of issues over the last couple of years with hallucinations, and we're not seeing hallucinations as much as we did, like let's say in 2022, but it does still occur. But also these tools, as they roll out, that's going to be an extremely long time before they're going to be precise enough to be used confidently without an expert clinical bedside nurse, critical care trained nurse at the bedside to really discern the data that whatever that tool is that's providing to the critical care team or to the provider team.
And Carl, you used a term that some people may not be familiar with when you said that hallucinations with this technology. Can you elaborate a little bit on what exactly that means?
If the last time you explored ChatGPT or it's Gemini or Grok or DeepSeek, whenever you go into those generative AI sites and utilize that technology, it should be pretty apparent that the responses that you receive back, those responses want to please you. They want you happy with the response that you get back. And so because the responses want you happy with it, and the software the software is dependent on us being really happy with what we receive from it. So therefore, we go back to it over and over and over again, and that's where we get that like kind of reliance on some of these technologies, which I do use every single day in certain parts of my clinical practice, and as now an educator at Jacksonville University. And so the long or the short of it is that hallucinations are where the training material that is used to create these generative AI tools is gonna inherently have bias built into it, and because the tools want to please you, it basically is giving you the response that it thinks you want to hear, even if that response is something that is possibly fictitious. And so every response that you get from a generative AI tool, whether that's at the bedside or if you're accessing an app on your smartphone at the bedside, it always has to be verified with an actual scientific or nursing resource that is something that is a little bit more of an authority.
Right. Which that kind of leads into my next question is, as a nurse, we need to become literate in AI language and in this technology in general. So, what is your recommendation for how a nurse can start understanding AI better and, really understanding how it can safely be used in their practice?
There's a few different courses on either Coursera or Udemy that are free courses. No, there's no cost for entry, and they're really good foundational courses that are fairly short that will basically explain to the student what a large language model is, and take you through a short history of algorithms and statistical approaches to understanding data, to now large language models try to predict responses based off of narrative that they receive during a prompt. So the best place to start is just to Google free large language model or free generative AI courses, and about 10 or 15 will pop up, and they're all okay. But I would say Coursera is usually a go-to that most people are at this point familiar with, and would use. And again, the barrier to entry is very low because there's no cost to them. After that, there are a few other courses that specialize in prompting, and at least taking a look at some of those courses that offer free prompting lessons. Even if you don't finish the course, again, they're free, but just starting those courses will give you a very, very quick foundation and give you the principles of how to basically become a prompt engineer to elicit the most precise response that you would like to receive from the generative AI tool.
So I know that I want to circle back to the second part of Vicky's question, which was, using AI safely in the practice of nursing. And, AACN continues to advocate that direct care nurses really need to be involved in the development of these tools that they would be using, because really, again, the end user, we all know that's who it's going to impact the most. And they should have input into how it's going to affect their workflow and their practice, et cetera. So, one is how can they use it safely? And secondly, is if they were interested in the development of this or using it, how would a nurse get started in this besides the courses so that it would be like healthcare specific?
Right. So the safe use and the ethical use of AI at the bedside, the first and foremost is to ensure that like you're not violating HIPAA compliance, right? So if you are entering maybe a client's lab values, or maybe entering some diagnostic data into a generative AI tool at the bedside, because you're using it to augment your clinical decision making, and ultimately you're trying to ensure that the patient has the best clinical outcome uh, from your nursing care. But the real danger is if you start using your phone to scan in results that may or accidentally have patient identifiers or patient data associated with the diagnostic data. So that is one danger that we saw at least initially early on at in 2021 and 2022 when we had nurses downloading the app and using it at the bedside. We saw some dangers in terms of entering data that may or may not be HIPAA compliant. So one of the things that we had to provide pretty early on was just some education in terms of what's safe to use at the bedside and what are some danger areas where you're going to want to avoid again entering any kind of PII, any kind of patient identifiers into a tool like this. And again, if you think about like as our different EHR companies, depending on like what hospital you're working at or what critical care unit you might be in, that your hospital's EHR might be working on generative AI at the bedside because they're not going to want to be left out. And so, because they're developing their tools that are integrated into the EHR, I think critical care nurses are going to be key to ensure that, like, while we have these clinical decision support tools that are going to be will be accessing at the bedside that may or may not have access to the internet, is what will that mean for our the confidentiality of our patient data?
I think about my own use of ChatGPT or any of these to help, build education and things like that. But, I know it's pulling things from the web and all these resources and data points that it can see, but I would be concerned necessarily of the accuracy of what it's pulling when it comes to healthcare information. So, would you recommend, especially an inexperienced nurse, proceeding with caution, validating what it's telling them is real? That's, I think, something that's concerning.
One more thing that we've seen, in addition to hallucinations that we covered earlier, is the bias that are in these generative AI tools. So if we all know at this point that there's no such thing as perfect research, there's no such thing as perfect population health knowledge. It's everything is generalized. It's generalized to general populations, and unfortunately, these models are trained on the data that we have, and we know that the data is imprecise. And so therefore, because the data is imprecise, you have to take all the information and all the responses that you receive from a generative AI tool and assume that there are biases that are just going to be inherently um, part of that response.
Well, and one thing you talked about in the critical care nurse editorial was the need to provide governance and policies for AI. So, how do you recommend that direct care nurses get involved and partner with their leaders to develop these policies and procedures and governance documents for AI?
Right, that's a great question. So most hospitals are going to have a informatics nurse, or they will have a lead for these tools, whether that is a nurse or possibly a small multi disciplinary team. So the best way might be through your leadership to reach out to these teams and engage with them. And our critical care nurses and our listeners might be really surprised at how receptive some of these teams are that are struggling to integrate these rapidly developing tools at the bedside, and a lot of times doing it without the actual experts that are fully engaged with them as they struggle to roll out these tools.
That's a good thing to know. Which I think then piggybacking onto leadership and just the use of AI is, I think one of the biggest concerns in healthcare and the public is the security of the information and the potential misuse. So, what are the ethical considerations when developing and using it? And really, more importantly, how do we keep our patients safe from either like a system breach or a hack and the misuse of the AI against a patient?
Right, that's a great question. So there should be information assurance certificates that are associated with the EHR that your particular hospital has adopted. And so a lot of that is behind the scenes, and as bedside nurses we may not see some of those things, that those basically assurances that are taking place, that are protecting the security of our data. So that unfortunately is something that a critical care nurse may not be necessarily engaged in. But your other question was asking about ethically, what's the ethical implications of using generative AI at the bedside, especially as we see it integrate more and more into our different systems in critical care environments. And that is, every hospital should have a basically an ethical AI framework, where it's very intentional in terms of the development and use of AI in a responsible way. And it's some of those core values that need to be shaping and guiding not only AACN, but really guiding healthcare organizations, is going to be the tenets of fairness, transparency, accountability, and above all else, safety, and having those guardrails in place. And as you spend time in different generative AI tools, and see some of the different responses that you get, having those guardrails in place, and especially regarding safety and HIPAA compliance, is going to be pretty critical going forward.
And I think this kind of brings us back to full circle. We started out talking about the fact that AI can't replace a nurse. That's the bottom line, that there's that human connection, that human relationship that is so critical to patient care. And you mentioned this in your editorial, but I'd like for you to really expand upon that, because I think that is probably one of the number one concerns we hear from nurses is they're just going to develop an algorithm to replace me. And we all logically know that's not true, but I'd just like to hear it from an expert like you.
We, as critical care nurses and as a community, have developed and honed a very specific skill set that is critical to healthcare organizations over many, many decades. And there's just no way that an algorithm is going to replace that human touch and that human interaction, of basically what we do every single day at the bedside, to provide a positive clinical outcome for our patients and our clients.
And I know we're talking about large language models here and, maybe trying to help with either documentation or some surveillance of, labs or, assessments, et cetera. But is there any talk about the use of, robots in the care of the patient? They have those robot dogs in the military. I have this vision and, you know, do they make a bed? Do they help with other things? And I do think in that regard, I think that's where some of the fear comes in because it doesn't look human. And could it replace the tasks, not critical tasks, but basic tasks? And so that is something I'm curious about. And I wonder if our listeners might be curious about it as well. It may be far in the future. I'm just wondering.
So far in the future, so far. I have used, and very briefly, those robo dogs, and
Hmm.
those have been around for well over a decade, if not 15 years. They've been around for a long time. I saw them years and years ago, and and they're at best able to carry a few supplies, and that's about all they can really do. There's their ability to really take care of themselves, in any kind of environment, is especially any kind of ruggedized environment, or any constraining environment like a hospital or a critical care unit. Those things struggle mightily in anything other than an open field or being able to walk down the street. They have the power consumption is very, very high, so they don't really last all that long. Many things we're working through. Not me anymore, but many things many issues that the DoD is working through to actually make those applicable and useful.
So basically, then the same struggles would be in something that would take over nursing tasks. It would be the same difficulties.
It's extremely difficult for any automated technology like that in the foreseeable future to replace any nursing actions. Here's where you'll probably see it first. It will probably be automated carts for nutrition trays.
I can see
At
that.
most is what you may see in the next couple of years. So I can see that being pretty successful, using like the auto driving kind of technology to make sure it's not bumping into walls, bumping into gurneys, bumping into, hospital staff. So we're talking about extremely basic and simplistic tasks.
Yeah.
I
And there's
think
still lots of issues with those because my husband works in the pharmacy world and they've tried to use them to deliver medications, and the the robots will encounter a narrow hallway or people in the hallway and it'll just stop and it'll get stuck on its way to wherever, kind of
Oh
like
gosh.
the robot vacuum. And so he said they're frequently having to go find it and reset it. So it's really not saving them a ton of time.
I think that should definitely help maybe ease people's minds a bit. I hope it does. And clearly AI is here to stay, whether we may like it or not. And I think it's so crucial for each of us to understand the technology, the security, and really the accuracy with its use to keep our patients safe. So, Carl, first, I want to say thank you so much for sharing your time and expertise on this critically important topic. But if you could tell our listeners one thing that they should consider about the use of AI in conjunction with their nursing care, what would it be?
I doubt that any patient or any client has ever said that they were so thankful that an algorithm interpreted their EKG rhythm as sinus tachycardia or normal sinus rhythm. But what clients say every single day is that they're so thankful for the critical care nurse that was right there at their bedside, usually at the time of a great need, and for some of them a life-altering event. And that is the key takeaway, is that generative AI is never going to replace really what we do in our mission at the bedside, of caring for our clients. And I think ultimately good patient outcomes come from what we do at the bedside and may not necessarily come from a fancy, innovative generative AI tool.
So we appreciate our listeners joining us today. We would love your feedback and suggestions for any future topics. Please send your input to podcast@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's Knowledge Assessment Tool, helping educators identify knowledge gaps and educational needs of nurses new to the unit or new to ICU or PCU patient care, with information available at www.aacn.org/assess new nurse.